Thank you for trusting Spay Neuter Network with your pet. Please follow these instructions carefully to help ensure your pet recovers properly after surgery. During the first 24 hours post-surgery, allow your pet to recover in a quiet, safe place indoors so you can carefully monitor recovery. This will help prevent possibly deadly complications from exposure to outdoor temperature extremes. Cats must be kept in their carriers for the first evening. Be aware that your pet's behavior may be slightly altered in the first 24 hours after surgery due to anesthesia. They may be glassy-eyed, sleepy, nauseous, wobbly, vocal, shivering, or irritable. Encourage frequent movement indoors, but no running or jumping, to help your pet recover from the anesthesia. Allowing them to rest uninterrupted will result in longer recovery and potential complications. Offer small amounts of water and the regular food later in the evening. Your pet may feel nauseous, and it can take up to 48 hours for their appetite to return to normal. You may notice your pet received a small green tattoo, indicating they've been sterilized. This tattoo is not an extra incision and does not require cleaning. During the 10 to 14 days following surgery, your pet should be closely supervised and on an exercise restriction. Keep your pet as calm as possible during the first 2 weeks. Avoid running, jumping, and excessive playing. Strenuous activity increases your pet's risk of developing swelling around the incision site that could result in opening of the incision. Keep the incision dry. No bathing or swimming. Use shredded newspaper for kitty litter to prevent dust particles from irritating the incision. Check the incision twice daily until healed. A small amount of blood is normal immediately after surgery, and some redness and swelling of the incision is expected and normal. Do not allow your pet to lick, scratch, or chew the incision. An Elizabethan collar is provided and must be worn to prevent potentially serious complications like the incision opening or becoming infected. This can be painful and may require follow-up visits, which could result in unexpected cost. Male dogs and cats can still impregnate an unsterilized female up to 1 month after surgery. Please keep a close eye on your pet. If sutures were used, you will be instructed to come back to the clinic in 14 days to get them removed. Tylenol and ibuprofen are toxic to pets, and aspirin can be deadly if administered after surgery. Normal issues after surgery include a small amount of bloody discharge from the surgical incision, redness or slight swelling or bruising at the site of the incision, whining or crying from discomfort the first night after surgery, decreased energy the first 24 hours after surgery, not urinating or defecating on their normal schedule, or a slightly open neuter incision for males only with minor discharge. Watch out for these signs of improper healing. Redness or discharge from the incision, particularly if it's not clear and thin. A foul smell emanating from the incision. Opening of the incision where the brightly colored tissues are exposed. Swelling, particularly if it's bulging, acute redness, or dark bruising. Your pet is lethargic or barely moves for more than a few days. Refusal to eat more than a couple of meals. Signs of pain for longer than a week, including shaking, hiding, and drooling. Vomiting or diarrhea longer than 24 hours after the procedure. Some immediately after surgery can be normal as a result of anesthesia. Bleeding or pus from the incision site. We encourage your pet to see their regular veterinarian for a post-operative exam 7 to 10 days after surgery to have the incision checked for complete healing, discuss additional needs, and for follow-up care.